Hello, my name is Sunny from Mythbuster News. Today I will be interviewing Matt, non-believer of organic medicinal remedies, and Kyle, who calls himself an expert hippie. Haha.
Haha.
Actually, Kyle has his PhD in natural remedies for bone and joint diseases. Recently, Kyle has hypothesized that fish can factually cure arthritis pain, but Matt believes that this is bogus. For our viewers who don't know, Kyle, what is rheumatoid arthritis?
Rheumatoid arthritis is an autoimmune condition in which the synovial joints become degraded and inflamed, leading to a cardiovascular disease and, in extreme cases, death. The immediate effects of RA include immobility, pain, and joint destruction. This disease is common more in women than in men, and affects about 1% of the population worldwide.
Okay, what does that have to do with fish exactly?
Absolutely nothing. Precisely my point. It is an autoimmune disease, which means that the body is creating antibodies and lymphocytes to attack itself. There is no helping this. It's beyond fish.
According to popular sources such as Dr. Oz, the human body cannot produce omega-3 fatty acids, meaning dietary sources such as oily fish must be the route taken to obtain them. Incorporating fish into arthritis patients' diet will help disrupt the cells that trigger inflammation. So,
Whoa. Slow your Mustangs there, old chap. Dr. Oz is about as credible as the so-called expert hippie.
I don't think he was finished, Matt. Is Dr. Oz correct?
well, I understand that Dr. Oz is not the most credible source. However, his accusations sparked my interest. I started doing some more research and found studies that would support that this popular source may have some worth.
So what exactly connects fish scientifically to these studies? Are there specific omega-3s involved in this?
Do tell. Because in my expertise, I have found no correlation between omega-3 fatty acids in fish and the benefits of helping arthritis. Only medications can bring this relief.
A study in the Arthritis Care and Research Journal performed a number of trials to determine how fish oil supplements affect rheumatoid arthritis, using greater than 3 grams of EPA and DHA a day.
What is so special about DHA and EPA?
What does the Environmental Protection Agency have to do with this?
EPA is just an acronym. Fatty acids, DHA, and EPA are anti-inflammatories. Although eating fish itself was not tested, it was inferred that increasing fish consumptions will lead to the same result.
Exactly. So eating fish itself was not tested. How can your hypothesis be proved through this study then?
The DHA and EPA used in this study was a bit more than the amount in one serving of fish. Those who used the fish oil supplements showed improved tender joint counts. This implies that fish that contains DHA and EPA, and obviously fish oil, would produce a similar result.
So what? You found one study, big deal.
Actually, another study published in Nature News researched the intake of omega-3 polyunsaturated fats to lessen the effects of the inflammatories as well, suggesting that OM3 fatty acid therapy could be used for the prevention and treatment of arthritis. The study confirmed that omega-3 can be taken as a supplement, but also could be taken in fish. A third primary literature source indicated that omega-3 fatty acids were associated with lower prevalence of inflammatory arthritis in those who tested positive, and that DHA reduced the risk of arthritis in those patients, also supporting my hypothesis. A fourth study in the journal Nutrition revealed that oral supplements of omega-3s, EPA, DHA, and ALA, prevented inflammation by lowering the blood levels of inflammatory biomarkers. Since omega-3s are rich in certain fish, such as mackerel, salmon, and sardines, the implication is that consumption of these fish should also lead to similar results as the study.
Well, I kind of have a pain in my arm. I'm going to grab some fish for dinner on the way home. You have changed my mind, Kyle. Not bad.
Well, you heard it here first, ladies and gentlemen. Get your fish while you can. Thank you, Kyle, for the scientific insight.